Welcome back. We are here talking all things healthcare. Morgan Campbell, Laura Packard, and Catherine CVA. They are answering your questions about healthcare enrollment and also about Medicare as well. You can continue to text your questions at the number at the bottom of the screen. All right, so this person is asking, do you include disability income when figuring your income for the Affordable Act insurance?
Yes, you do.
Okay, and that's just a quick, easy answer there.
Yes, you do. Every time.
Every time. Okay. And then this next question is, what about those of us who are already enrolled? Is there a better plan that I can opt out and re-enroll?
So very possible it's going to happen in the plan. One of the things was that they were going to make silver plans at a zero premium, depending on your tax bracket, your income, your dependents that you claim. So you could go from a bronze plan of paying out some money to a silver plan that might not cost you as much, but you have to go in and complete your application April 1st.
Okay, April 1st. Laura, this person is asking, are there resources available to help people cover the cost of health insurance? I don't make a lot of money at the moment.
Well, the American Rescue Plan included beefed up subsidies for everybody, regardless of how much you make. So you should definitely go to healthcare.gov and make sure that your income is inputted there, or if you're working with a broker, they can help you. Now, North Carolina is one of 12 states that didn't expand Medicaid. So if your income is very, very low, you might not make enough to get help with the Affordable Care Act plans, which is why North Carolina legislature needs to act. But if you had, if you're unemployed, if you had a job last year and lost it, then you may be eligible for different kinds of help with your health insurance that way. So it probably makes sense to talk to a real human like Morgan to help you figure out your best options.
Right. And again, if you did not hear, the Affordable Care Act enrollment date has now been extended to August the 15th. So you have much more time to enroll. And the new plans and pricing will be released April the 1st. So you might want to hold off just a little bit so that you can look at that pricing again. I know, Catherine, we were talking about the Medicaid enrollment for the state. Is there anything else that you wanted to make sure that people knew about that?
So Medicaid enrollment ends on May 14th. Unfortunately, we have so many different dates to keep up with now. So it's important that you go and look at your plan because it will change July 1st, and you may want to make the selection of which plan fits your family's needs best.
Okay, and this person is asking, if you're not working, is there insurance that you qualify for? Which way would you tell them to go, Laura or Morgan?
I'll let Morgan tackle that one.
So if they're not working, but they're receiving unemployment, then they're probably going to qualify for a substantial tax credit to offset their premiums through the Affordable Health Care Act.
Okay, and again, if you call an insurance agent and you ask them about which plan is right for you, they are not charging you. So we want to make sure that you know that. All right, Catherine, this person is asking, do you sign up for Medicare online?
Yes, you can sign up for Medicare online. And that is really the easiest way to do it, but the Medicare offices are also available to help you if you don't have a good online confidence that you can do it.
Okay. Laura, this person is saying, if you already have marketplace coverage, will the premiums change or is it just for new customers only?
They have said that they are going to make everything right, but you might not get your money back until you file taxes next year, which is why you if you've already got a policy and you don't go to healthcare.gov to update after April 1st. So you will eventually get there, but if you want your money faster, you should go back and go through the hoops again.
Okay, quickly, we have about a minute left. Morgan, could an ACA plan be more affordable than my plan through work? And if so, can I opt out of my work plan?
You would have to meet the income limits on that. We would have to do some calculations as your income and do you actually qualify for a tax credit. It's once again going to depend on how many dependents are in your house and what your income bracket looks like.
All right, this last question, are you automatically enrolled in Medicare at age 65?
No.
No, you have to do
You
it on
have
your
to
own.
do it.
Yes. All right. Thank you so much for sharing your time and your expertise. If you missed anything, don't worry about it. It's in the Who Wants to Know section right now, along with more resources as well when it comes to the Affordable Care Act, Medicare, and even Medicaid.